A very good afternoon, dear listeners. This is Akashvani, Kohima at 103 megahertz. You are listening to our program. This is, yes, indeed, your ongoing program in focus at Drug Free Nagaland. And we have in our studio an exceptional list of panelists. But before I introduce them to you, my dear listeners, let me tell you that you are tuning in at the station of the region at 103 megahertz. Mallory, Shamato, Dumapo, Tening, Mon, and Twinsang, you are tuning in with me right now at 100.1 megahertz. Listeners from Mocha, it's 101.8 megahertz. Listeners from Peg, it's 102.1 megahertz. And listeners from Zeneboto, you are tuned in with me right now at 101.2 megahertz. We are also available on our app. All you have to do is go to Google Play Store and install the app News on Air. Yes, my dear listeners, News on Air app to download Kuriluwi and click on live radio to listen to this program. Also, I would love to hear from our dear listeners. So if you have any questions, any queries, if you have any opinions, or if you just want to share your thought with our experts in our studio, then you can write to us at 9436805333. No char 36 de message kurubule parebo. But don't forget to prefix your message with the code FM space F. Arabnila naam aur jagah bhi likhi na pathai dile do bishi khushi pavo. So my dear listeners, as we begin with our program here, this program is a radio live bilingual interactive program initiated by the regional news unit Akashvani Kohima in collaboration with Nagaland Police Department. So my dear listeners, the topic for this program is impact of drug abuse on society, exploring social, economic and cultural consequences of drug abuse in Nagaland. And in our studio today, we are in fact very privileged to have in our midst Padma Shri Mrs.Neidonuo Angami, veteran social activist. Thank you so much, madam, for being with us, and thank you so much for gracing us with your presence. We have also in our studio Mr. Joybell, Deputy Superintendent of Police, Crime Branch. Thank you so much, sir, for consenting to be with us today. And also in our studio, we have Miss Suyimtenla, Jamir, clinical psychologist, Tele-MANAS. Thank you so much, ma'am, for being with us. So my dear listeners, as I have mentioned, this is going to be a bilingual program, interactive program. So questions can if you have any questions that this is an opportunity for all of you. Grab this opportunity. All you have to do is type the code FM space F, write to us at 9436805333. So yes, let's get started with our discourse here. So ajila topic is impact of drug abuse on society, exploring social, economic and cultural consequences of drug abuse in Nagaland. So itula upade, my first question goes to Madam Neidonuo. How have you witnessed the social fabric of Nagaland being affected by drug abuse? As you have been a member of Naga Mother Association, in fact the founding member, so how has drug abuse affected our Naga fabric, the societal Naga fabric? Please share your experiences with us.
In the early days, it's in the beginning of 80s, Naga society did not know what is addiction. We were very innocent. We had some alcoholism problems, but on drugs, nobody knew what exactly it is. But because of some of our children, they got affected and infected with drug addiction, we have also experience dysfunctional homes. It affects the family, the society, and it became a real problem in the early 80s. So we realized that we have to do something to save our children, those who are affected. And since this is a new thing to us, we felt that the best thing is to fight against the traffickers, without realizing that our children's demand is being supplied by the drug traffickers. So it was very innocently we also began. And step by step, slowly we realized that we have to do something very seriously. If we stop trafficking, if we stop the supply, how can we stop the demand? Actually, demand reduction should come first, then we could go for supply demand. But instead, we went for supply demand first, rather than demand reduction. Actually, ami khan la bacha khan na mangile na pabo to. Inu ta khan mangia para tai payasin na. Itu para ami khan drug traffickers logore ami khan any means na ta khan logore na fight kushi de ami khan mothers khan na. Kitaba du police khan age para bi ami khan jagina action dui thaki na. Itu ami khan aru police khan bitor bi gondogol ulaise ro. Police khan du ami khan ke blame kore. Ami khan du police khan ke blame kore. Tumi khan nora karne ami khan kure ase gobo. Ami khan. Aru tha khan tumi khan kile ami khan la kam kure ase. Ina ko kurine gondogol bi bishi ulaise ro. Holi bi aste aste buji kene na. Education pai do ami khan bi kuria logo na. To piche du ami khan police khan ke support dia nisna ho jese do. Ta khan ke support dikene ta khan ke encourage kurikene traffickers khan ke duribole dise do. Aru mothers were very active and so united at that time. So colony na mothers khan miligene nijer colony de drug traffickers thakile report koribi doribi itu message tu pathai thakile na. To sob colony de aware ho jese do. Ekbar tu aru itu pura ami khan nije bacha demand kora khan bi na bishi dar paise ta khan bi bishi duk bi paise aru sobse bal kotha ekta tu ami khan itu time de bhabya tu drug tu khali Imphal pura hai national highway itu through gorgina Kohima te aha tu Kohima bypass kora tu sob Manipur pura hai kogina na ami khan bhabise itu Thizama gate tu na Thizaman hoi Khuzama gate. Our understanding is that is the first gate that they brought up duro pare naga bhabisiro. Itu kade tate amma khan logoti bi kotha kurginde ta khan bosti maiki khan ke bus khan truck khan check kurubole disiro. To tate bi police khan logoti aru gondogol hoise ami khan bi na. Police khan agete itu khan gari te uthi jai gari rukhile na. Aru jagina hala kuri kine kiba kibi ho jai na. To police khan bi digdar pai. Itu pura tate bi enaga gondogol kurigede ami khan tumi khan kuribo nora ami khan kuri ase man takbi ko kena checking to bishi kure inaga hoi kena olop ding tu na police khan aru tadila ama khan bi kotha mili kene they made mothers aware that is not their role it's not their duty to go and check itu do ama khan ki bi bujai diso na to tinole kinaga hole ami khan police khan ke support dibo paribo to khan bi bhabika na ekbar tu first time and I think that was the last ama khan bosti de na kiman gor ase ek cup chawul gor pra donate kurse de 1 cup each from each house ina kogine police khan logoje dise do ami khan la chawul do ta khan ke encourage koribole aro kiteba osore jaigena ta khan dodibi kotha kure ina kogine aste tu buji jase tate holibi aru Kohima town te holibi aru kiman gondogol kiman digdar pailebi ama khan bi kam tu kurbo parise de because that is the time during that time we could catch the kingpin of the trafficker mustaking koi kene kingpin thakse do itu time de muslim manna ase Dimapur te thake aru kiteba durise taike holibi aru bel loi kene ulai thake aru taike kubi kurbo nari kene thake to ama khan jagina taike durise to CRP khan bi bishi aise to CRP khan police khan ama khan jagina kuradu police holibi CRP khan holibi taike save kurbo pare na to ama khan taike tani kine na police khan laga hatte digine police station tak punchaiso itu nisna ama khan bi bishi kam tu kurbo parise that time holibi drug addiction la problem tu hole tu bishi dangor kotha ase kinaka hoile etu komti kurbo paribo kwatu if we want to change the situation we have to create awareness and give education on what is addiction it is important as they unless you know the causes of addiction it is very difficult to stop it our society tak to social evil itu nisna bi thakibo naharabo to but if the demand is controlled supply is automatically controlled in our society till today we have not had sufficient awareness programs on prevention prevention la program te hole do we have to educate the mass about the causes of drug addiction. It is important ase. Man duri debi man ki koi debi na at least try to control the demand. Na nije gode nije bata ke tala demand to control koi debi na. Aste tai chari dile na supply to nahi bodo.
Very true.
Gode na.
Automatically comty hoile supply will automatically go down. Like any other business.
Hoi. Aru dusra ekta kotha do American NDPS Act to bishi banaise. Bishi bal banaise. Hole bi itu act pura ki la paise. It will be there's a big question in that. Rule de hole durile do fine ase na. Aru fine no hole do ta khan ke charibo nare. To fine kiman duri ase itu fine khan puisa kun loi. Itu bi kotha ekta ase ro. Fine la puisa khan jama kori kena na. Itu de-addiction rehabilitation center khan cholabo lagyo. Ami tu itu bhabe. Cholabo rehab ekta cholabo kule bi puisa lage do. Aru department alak khan bi kiman dibo. Ta khan ke modot pailibi ta khan pura modot pailibi na independently de-addiction rehabilitation khan cholabole. Itu collection of fines. Itu khan bisari itu khan paile na bhag kuri kene alak district rehabilitation kuribo paribo to.
Wonderful, I think, suggestion by our madam. And thank you so much for sharing that tumultuous journey of Managa Mothers Association. My next question is for Mr. Joybell. Can you shed light on the current challenges faced by law enforcement in Nagaland in curbing drug trafficking and abuse? And how is the police department working in collaboration with other stakeholders?
First of all, thank you for having me. I'm glad I'm here to share a few of my opinion. See, when you talk about the challenges that as a law enforcement agency we face, we have to understand what drugs abuse or trafficking is all about. We have to understand the situation first. And to my mind, like as Madam was already highlighting, we have to see the demand and supply reductions. Then to check the demand and supply reductions, we have to understand that Nagaland shares at least around 215 kilometers borders. And we have so many districts bordering in the Indo-Myanmar border, including Mon, then Nokla, and so on. We need to have a holistic approach to deal with the drugs abuse and also for reintegration of those addicts.
Former users.
Yeah, former users. Presently, the law enforcement agencies are, we are giving our best and we are upgrading our skills and we are also trying to spread awareness. Reorganization of we call it law enforcement agency, LEA in short, that we have reorganized, restructured in a sense that now we have a state level anti-narcotic task force. And in the district, we also have a district anti-narcotic task force. This task force are the primary or their priority is given on narcotic substances, their impact on the society, so on and so forth. Yes, we may be late in initiating all the things, but we are not that behind. And having understood the consequences and the probable impact that drugs would harm our society, we're also taking up steps. But we do face several challenges. Why? Because Nagaland is a transit road. We don't cultivate or, so to say, manufacture. Now, to get the kingpin, it is not an easy task. We may be arresting one or two, or maybe hundreds of them, but still the kingpin remains there. And it is believed that the manufacturing are done somewhere in Manipur or outside Manipur, and we don't know exactly where it is. And so it is quite difficult to apprehend the kingpin. But recently we are gearing up with our investigations, and we are coming closer to some kingpin. So I hope in days to come we will be able to find them. But there is also another challenges which we face because we doesn't have a proper infrastructure, supposing like forensic lab, and we doesn't have that medical facilities for testing a person whether he's actually a user or not. See, when we do the investigation, we send the consignment for forensic investigation. It takes around 4 to 5 months, or sometimes more than 6 or 7 months. So in the meantime, Madam was saying that the accused used to get bail in the meantime. And the investigation agency cannot help much. Why? Because the mandatory period, as per the NDPS Act, lapsed by that time. So the maximum period for investigation is 120 days, so to say, for commercial substances, but which is 3 months. But during the course of investigation, before we actually understood whether these consignment are drugs or not, before we received the reports, the accused used to get bail out. And we also awareness program, and we don't spread so much of awareness, perhaps even in our social organization, starting from the family. So when we say about or speak about awareness, I think all the educated person should start that and portraying the evil side of the addiction. It's good to know what drugs is, how it works. Yes, it's good to know, but in my own opinion, if I'm given an opportunity, I will rather portray the evil side of addiction than to actually understanding what drugs is all about. So because drugs addiction really it destroyed the whole family system, the whole fabric of the organization. I think that is what I have for now.
Thank you so much for sharing that, and also about the task forces in the districts. The department is trying its level best, but as Matt Sir has also mentioned, it's all correlated.
It's all
correlated. So even as a responsible citizen of a country and a state, it is our responsibility to educate ourselves and people around us. My next question is for Ms. Suyam. When someone takes drugs, or when someone is an abuser, it's not just his physiological body that is affected, but his mental health, everything gets affected. So how would you describe the current landscape of drug abuse in Nagaland from a psychological and mental health perspective?
Well, first of all, thank you for having me here. To be a part of this panel is amazing. I hit the ground running when I came back to Nagaland after my education and everything. And I was pushed into the into the field, and then getting to know what's going on, the underbelly of Nagaland. That was the first thing I saw when I came back home. It wasn't coming back home to comfort. It wasn't coming back home to comfort and enjoyment of coming back to family. It was rather coming back to a very dire situation. So that's how I would, connote this drug situation and Nagaland. That's how I would correlate it. It's very dire right now. So what's happening is we see all of the aspects and avenues of lives being impacted by drug and alcohol abuse. 50% of clients that I try to deal with are usually people who are using alcohol, using drugs, or they're polysubstance users. So it's not just I have experimented with ganja. I've experimented with other drugs. And then there are those who are using drugs specifically because alcohol is not working for them. So you see this issue turning into a giant when all the other avenues of life, like our social aspect, our personal aspect, they're not able to cope up with it. So it's a very difficult situation right now. And you see the push and pull here. There are so many gaps. We have issues of prolonged rehabilitation facilities not being available. We have also issues of people living in really rural areas that come to our semi-urban facilities, and they come here, they try to recuperate. And before they can actually try to recuperate, life catches up with them. Family depend on them, so they have to go back. And they're going back to a scenario where they have been educated, but the rest of the people have not been educated. So there are a lot of gaps. Here, now the psychological strain is that stress will increase. What is happening is we tend to them, the medical treatment and everything is done for them in the beginning phase. Then the psychological interventions come into play. They understand with the clarity of treatment that has happened, with the clarity of mind that's happening, they understand, okay, mo idu khaishu biludo, idu hoyese, mo la body gibi, idu impact hoyese. The thing is, we make them understand how they're accessing their reward pathway easily. And we try to tell them, why don't you implement yourself in other avenues of life? But then they ask the question, but what? And there we cannot answer because there is a gap. Because we say, why don't you go for vocational training? But what again? We have to actually understand that they have been so crippled by drug use that they don't even understand what their abilities are. It's like just putting on the diaper, cradling them, holding their hands, and then letting them move forward. So a person at 20 who we have to make sure that their abilities are being assessed and everything, trying to understand, making sure that they understand their personality on their own, it becomes a very huge task. So again, the amount of resources that we have, it's subpar. I would say it's a very dire situation. Psychologically, it's taking an impact. We help them recover, but they're then again faced with life, the choices of life that they need to make after this. What now? They go back when they're unable to even process the information that they've received, and they go back to their society where all of this is happening again. So again, our interaction hui jawo, interaction ho adam ne do taibi chule se ini. What's so different? How am I different? I mean, I'll go back to this. So that's the choice that they end up making, and it's the choice that the society is making for them as well, because there are not enough avenues. So mentally, it's a very big rubber band ball. Rubber band, ekta. We cannot cut everything at one go. It's like peeling an onion. But then again, at the crux of the situation is that we need to make sure we're filling all the gaps. So what after we, Sarah said, integration back into the community. So what? How do we integrate? Where are the vocational courses? We need to make them understand that job satisfaction is not about having an IAS position or some kind of officer position, but being able to be satisfied with the work that you're doing, be it a farmer, be it somebody who is working in a shop. That satisfaction needs to be there. So we need to make sure that the youth is being sensitized about this system and this process. So I think we really need to pull up our sleeves and work
on that
it.
note, my question is for Madam. The whole process of drug taking, like some people are involved in it for a month, for 6 months, for 6 years, or for 10 years. So we have met people who started taking drugs when they were just mere 15, 16 years, and they have been abusing drugs for almost a decade or even more. Now sometimes maybe they also want to change korole mon jai, so they seek for medical help. Medical help to paishe, the whole detoxify so pujhe. But again, they getting integrated in the society, like Miss has said, it's a big challenge also for the society, because now society has to accept a member who was never part of this social group. So where does the social organizations key changes korle balwa, and how to approach this?
We have to start from the family level. Addiction, it is known as a disease, and this disease is also known as a family disease. So the family has to accept the disease that they are already having in the family. But it is very difficult for them to admit, because in this addiction problem, the family denies. Denial works a lot in it. This is due to shame and guilt also. But family do sorom bhi lage, boy bhi lage. Inoka bapna prana manuke kobole mon nai. Inoka kuria pra lukai kene din to pass ho jai na. To itu ke denial koi denial to hai kam bishi ho jai. So if the family do not deny that they have a problem, then they can go for the support for change. But as long as takan lukai rakhibo na, itu tu change kuribole bishi komti ase to, jaga komti ase to. Kintu family to open hoi jale na, they can help the addict also faster. Addict ekta tu jagine rehab te thaki na, rehab para program pas 6 moina thaki na shikilu dibina. Again he has to go back home. To home te jaile, tala family tu tai ki bimar ase itu na bujile, tai ki bimar hoise na, itu bujibo lage. Aru tar bimar tu ami khan sob ke lagise itu bujibo lage. Ha, kile mane tai kiman luka bole koshish korbo, family bi man lukai. Tai kiman lukabo, family bi man lukabole ho jaye. Itu karne tai ke treatment loa time te family also needs equal treatment. Equal treatment in the sense that medical no hobo pare, but psychological hobo lage. Ha, aru facts to family to accept korbo lage. That amila gote amala pasati naka hoise. Tai kade ki bala ase ami tade volunteer korkene ami bi program korbo. Inoka babna ahile na, that will help. Otherwise sooner or later itu chokra tu gote jabo aru same problem again. So if the family does not change, how can we change the society? To ekta bosti ekta de family ekta duita inoka change ho jale bosti manu tu bujibo. Kintu denial para kam kuri thakile kitebi kam tu nohoy. I'm very happy now that the police department is doing very well. Kintu amila tadi amar bapna de inoka kuria time de takhan la family khan addict khan la family khan logote program na kurile du kinaka hobo na ami tu bhabi de. Education should be given to those affected families. Kile mane ami addict hoi jabo koine tai dawai khane to. Ami alcoholic hoi jabo koine tai modu khane to. Kintu family la circle te hai na ki ase itu tai he jane aru tara family he jane itu kane tai kiman stick para shikai lule bi tai sooner or later family logote aru jabo to family la attitude change no hole na along with his recovery tai ke modot koribo naribo to.
As Madam has mentioned, that shame and guilt plays a vital role when you are trying to abstain. So how does stigmatize Pikre, as we all know that Nagaland is a very close-knitted community. Modad bhi bishi kure itu nishna shame and ostracization bhi bishi hai. So how stigmatization is associated with drug abuse and its impact on mental health, especially in people in Nagaland, and what, according to you, are the strategies that should be employed to reduce stigma?
Stigmatization has been a major factor for people relapsing back into the cycle of addiction. It has been one feature that we have to approach, like from every department has to approach together. So this is where the collaboration needs to start, happening. Because stigmatization, addicts can get, do not put yourself in a box. You are not that. Because now addiction to is ma'am ko anishna bimar is na. It's a mental illness. We need to understand that the mind and the body are always connected. Your mind gets weak, your body will fall sick. Your body is weak, your mind also starts feeling weak. So you do mind-body connection to understand Guridina. We try to explain to them psychological and biologically we see it as an illness. So you need to understand it as an illness and it's okay that people are going through it. But we bring them out of the box. But we're bringing only one individual out of the box when the entire family is in the box. How do we break down the walls, Vijay? So yeah, breaking down the walls has been a little difficult because what's happening is far off places, addicts can get people who are using both alcohol, drugs can be anina family can be their attitude is like ma'am has said again. It's even to the point of disgust. Because again, you see the ripple effects of in the 1970s when the drug infiltrated Nagaland, when ma'am has said it was so innocent that time. So the retaliation was reaction. That was it. Because that is what that's how our society is. So it was force of hand. So you do though that ripple effect has come till far. I'm being very audacious and saying this, but it has.
She has also mentioned that less educated, we did not have much awareness about how to deal with it. So the first quench, na? It's
Yeah.
reaction.
It's a
And that is
reaction.
how every
yeah.
normal person
And
reacts.
now I think we need to strategize. We need to inform, because now we need to actually remove the walls. It's not about just putting down the walls, it's about removing it. Because then if the family gets educated, again, the family will then again relate to another family, to the extended family, then to the community. Because again, like you mentioned, very close in community, Mohando, everything that happens is like correct the next stage that connection is always there. Mohalla family, Mohalla society, that's how it's running. So education, when it's happening for the individual who is suffering, itu them the psychoeducation for the entire family as well. It's very important. And another thing that can actually help is when the communities come together. So I said collaboration in the beginning. So right now with the police department that's doing this, this is amazing actually. And I've noticed one thing in Nagaland, like after coming back and working here, like it's just a personal experience. I've noticed that even the hospitals don't communicate with each other. Which is really surprising for me. I'm like, health bodies should be communicating with each other. There should be a collaboration even within within the capital also. We don't know what's happening in one healthcare facility. We don't know what's happening. So where's the data then? Yes, we're talking about it now, but do we have it in numbers? So that we can see and we can strategize. So that the police department can also strategize. So that social welfare can also see the numbers and understand, okay, society is this right now. So I think that's one wonderful way of being able to just curb the problem of the drug issue, the alcohol issue as well. Yeah, and church communities, they really need to start understanding alcohol and drug use as an illness, and they need to start talking about it as well, as in sensitizing the community, because that is the biggest local body that supports public directly. They need to be celebrating with the government facilities when we're doing World Mental Health Day. They need to be voicing out as well. Autism Day, everything. They need to be able to talk about all of this as well. So they have a platform. So now we need to ask, why are you not using it? Because is it a taboo? Yes, it might be, but it's the problem right now, and you cannot look away. Turning away is not the issue right now. It should not be done right now.
That's a great suggestion. Every department, every section of the society is doing their best, but sometimes that is not enough. You have to come together and work for the society, because at the end of the day, it's affecting our own society, it's affecting our economy. So we are going to continue this interesting discussion, but let's take a short break and we will be right back. Welcome back, dear listeners. This is Akashvani, Kohima at 103 megahertz, and you are listening to our program In Focus at Drug Free Nagaland, ongoing series, a radio live bilingual program initiated by the Regional News Unit Akashvani Kohima in collaboration with Nagaland Police Department. In our today's program, the topic is impact of drug abuse on society, exploring social, economic, and cultural consequences of drug abuse in Nagaland. We have in our studio right now Padma Shri Mrs.Neidonuo Angami, veteran social activist. Along with her, we have Mr. Joybell, Deputy Superintendent of Police, Crime Branch, and Miss Suyimtenla Jamir, clinical psychologist, Tele-MANAS. So this program will go on till 2 p.m. So my dear listeners, if you have any question that you want to ask to our experts today, then you can definitely write to us at 9436-805-333. Don't forget to use the code FM_F, and we would love to hear from you. So yes, do write to us from where you are writing. So as we continue with our discussion here, my question is for Mr. Joybell. What government policies and initiatives, as you have mentioned that the department has set up district task force, so is it effective in addressing the issue of drug abuse in the districts? And if you could highlight more initiatives and policies that the government or the department has undertaken.
See, like recently, it's a kind of very recent activities. Nagaland Police have as I've said earlier, restructure itself, and we have the narcotic coordinates at the state level, and we also have the coordination at regional level and the central level. Now this filtered down to district anti-narcotic task force. The whole idea of the coordination center, or the ANCORD we call it, is to have a coordination between all the stakeholders, which include various departments and various NGOs and the public as such. The initiative that we have taken, the police department recently, we are constantly in touch with the other departments, especially with the excise, social welfare, medical, with whom who are the, so to say, one of the most concerned organization or members, and with the regional or with the central organization, we are seeking their guidance, their assistance, and their cooperation. And actually, we are also proposing many times for interstate coordination meeting, and the police department led by our DG is very proactive in this matter. So meeting can be Matiase. Hopefully, it will be held one of these days. We feel that Nagaland Police first of all, we have to clean our own kitchen kind of thing. Because we see many policemen under the influence of intoxicants, including drugs. They perform duties sometimes, and see like whenever a person perform duty under intoxications or under influence of the intoxicants, so taito normal no. So the whole duty is void hoizaina. So Nagaland Police is ito ekta initiative lagi na asine self declaration karne police personnel sanke. And that be I can't exactly take the numbers, but from all the units, some are alcoholic, some are drugs addicts. Now, when they are volunteering themselves to undergo treatment. So that is also one of the big initiative. And recently, we also police also came up with a pledge, anti-narcotic pledge. So to be district level te administered when we organized some programs, awareness can be now to amikano mundi kina kriyaze. One is na ito anti-narcotic pledge lagado. In my own opinion, amido school te walibi, college te walibi, like any social event and te walibi. If the state government can make it kind of mandatory maybe it to highlight people will be more aware and we encourage people to take pledge. See, when we speak to ourselves, when we take the pledge to ourselves, we understand and we take the pledge. So it will avoid karena. So these are some of the activities that we are doing. Of course, many are in pipeline. The police organization are many are in pipeline. The reorganization, strengthening the investigations, the human resource development, the infrastructural development. So but yes, we all know that nothing happens overnight or in a day. Drugs be to our society. It creep in, slowly it engulf the whole society. So to do away with that mammoth issue, we have to handle slowly. Now want to civil societies can whatever that which I want to appraise them or and seek cooperation from them. So there is as per the law, like there is a certain limit up to which extent the civil society can go. Aru kotebra that legal organization like police that they start over again. There will be that we have to understand that our own limitations and extent. So civil societies, they can cooperate extent. We expect their cooperation. We're living not to the extent of taking laws into their own hand, as it has happened sometimes back in our state in Waka or GG, something like that. So these things should not happen. If it does, then it spoils the whole thing. So never take law into one's own hand and report to the police. That is the best. To the youth, I can only say that do not try. Do not try. Stay away.
It is a joint effort from all the section of the society. However, we should all know our limitations, and draw the line. On that note, my question is for Madam Kwanishna. The civil societies have also played a huge role in curbing and fighting drugs. But in the process, we have made observation that drug user peddler there are laws in place that have stringent laws for be it punishment be it fine or be imprisonment or be. But even civil societies can be, they have their own fine be humiliation be in the busti de handi na. Everybody knows everyone. Though it humiliation can be and that leads to discrimination. That leads to isolation. That leads to stigmatization. So what is your point of view in that? And can you improve civil societies? Intention is really good, but sometimes it can make more trouble.
It does. Actually, if I have to fight against my enemy, I must know who my enemy is. That's why our enemy is the causes of addiction. Taikile addict ho jai. Godekile family abnormal ho jai. Itu kan kinaga dala body, mind, spirit sub spoil kore na. Itu kan ami kan bujibo lage. Then we know that addiction is an enemy. Titya fight kuro pare to. Kintu dala mon kinaga ho jai na jane, dala physical body kinaga ho jai na jane, dala spiritual pini kinaga ho jai na jane. Spiritual pini to tai any addict. Ta kan sob se khogutia do ishora kotha. Ishor kole ta kan psikhoguti jai. Our body do without the substance, they cannot remain normal. The body can effect kore. Our mind too always on the substance. Itu take man biya kore na. To inaka hole bi tai proper treatment kan loi thakile tai ekdom normal hoi jaro na. Aji la amikan la society there aji we are very fortunate in one way. We have lots of recovered addicts and they are the role models. We should utilize their services. Takane jane do amike kiman effect kurise apuni logotibe kurise na. Holebe amike effect na ku amin na janile apuni ke kiman effect kurise na jani bolo. Itu kane we should use the services of the recovering addicts. Takane role model prana. For example, police kan ajikali kot treatment thakile bina unless their families are touched, it is difficult. Tai treatment center pra direct duty de na jabo do gorda hebo Total family to responsibility ki ase. Family has to know their responsibility. His wife or his children must know their responsibility. That's why I have a suggestion for police department. So far, what you are doing is very good. We are very grateful to your DG. Kintu khali addict ke aro alcoholic ke apuni khan sai ase. Itu pra na punchi bude. Unless the la family ke bit na chule. To the la family ke chubole tu osol tu apuni khan la kamin hoy. Kintu itu program jadya mano utu khan ke handle kurbo lagi do. Because they also need as much treatment as the addict. Mental kina effect hoy, physical kina ka effect hoy, spiritual kina ka effect hoy na. Itu kan family bi jani bo lagi do na. I mean family are also equally affected. So my suggestion is okay, if we can let some organizations know about the number and the people who are under treatment. Itu kan la family ke kina ka address kurbo lage. They may be in different districts, but we have different rehab centers also. To recovering addicts khan, counselors khan ke matibina, family khan ke address kurbo le. During our time, ajikali ekdum role model hoi jadu bishi ase. Only most of them they were treated during our time. We were very strict. Take kiman treatment inputs dia na. Tala family ki dedo. Every month we used to have a family meeting. It is called Family Anonymous. Anonymous meeting kurigene addiction ki ase itu kotha kore do. Our recovery ki ase itu kotha kore do na. Itu khan para hai bishi result bal ulase do. Ajikali itu bi komti hoise. We are going too fast in one way. But unless we deal the root, no, let us not blame the family or the addict. We are sorry that they are affected with this problem. So we need to help them. Itu bujibo lagi do.
We have always heard about AAs, Alcoholic
Yeah.
Addict Anonymous, but family labi it will be important, like you said, madam, root to tade ase. That person has to come home, has to be part of that family wherever he goes. So that is a wonderful. We have discussed in length the effects on family and the role that family plays, the police plays. But let's discuss what are the preventive measures and rehabilitation programs that have proven effective in addressing drug abuse in Nagaland.
Well, the programs...
And if there is any improvement and innovations that can be made.
I've been speaking to people who have already been in the field for this interview, and since I'm fairly new to it, but I've seen that the drug problem has been evolving, and accordingly Nagaland has been trying to cope up with the issue as well. So rehabilitation facilities such as detox centers, I think, are doing quite well. I mean, of course, we need to gear up and pull up our sleeves, and we need to have a more number of professionals working in these fields. However, I think they're doing a good job. Also, I see that yes, prayer centers, they prayer center instead of looking at it as an issue, why not educate those people in the prayer centers? Because I've seen many people go to prayer centers, ventilate
every platform,
utilize everything. It's a zero tolerance issue now. It's approach.
Prayer center that do spiritual fitness, of
course.
But what about the body and mind?
Yeah, what about the body and mind? So we need to sensitize people at prayer centers also, make them understand that this is the issue. If you're going to fight with the situation, then we suggest you understand the entirety of the situation. Another thing is telehealth services has been set up, which I'm a part of. So people can call 14416, which is our helpline number, to ventilate. To be able to, if you're able to ventilate, you'll have clarity of mind. If you have clarity of mind, you'll be able to assess your situation and seek help. Then we have Project Rest, which is a daycare rehabilitation facility that's also coming up. I've seen that one-on-one sessions really do help people, individual sessions, and then anonymous groups are a great way of facilitating these people who have recovered. Like ma'am and sir has also said, we need to weaponize their stories. Like I keep telling people who are counselors going back into the field as people who have recovered, you need to weaponize your stories. You need to make sure that you're hitting all the right targets when you're trying to bring somebody out of addiction. So using people who have already come out of it, this is it's the most simplest way of helping somebody who's actually dealing with the issue right now. So on a macro level though, yes, we need to educate people on the laws that are available also, that they can use. Like Sir has said, don't take the law into your own hands. Reach out, understand what is your right, what protects you, and reach out accordingly, and then reach out to the right departments. On a macro level, education systems need to have proper education of what addiction is. The books need to sensitize children, because children as young as 10 to 12 years are now interacting with alcohol, with tobacco. See, it's become a casual thing for them right now. Experimentation is at that age, so they need to be sensitized at that age as well. So on a micro level, using people who have recovered, then making sure that they're using their stories as a weapon, then reaching out to all the local bodies, panchayats, all the women groups, all the men groups, that the associations that are there, the cultural tribal groups as well, reaching out to all of them, sensitizing them, making them understand the information, and creating that chain on a micro level and on a macro level. I think that's a very great approach, which of course we've been trying to do, but I think we can do more. I think
we can always do more.
Yeah.
Because the numbers are rising, the users are rising. So as society, as member of society, we can always do more. And thank you so much for sharing. I think we can all agree that we should use all platform available to educate our people and to educate our families. We are running out of time. I don't know how the past 60 minutes has gone. So we have just few minutes remaining. So what is the final message that you would like to give to our listeners in your own short words?
Well, we have to accept that we are suffering from addiction as a whole, and we need to recover from that disease.
Simple, but to the point. We are all suffering. We have to find some way to get ourselves healed, to get our society healed. Sir, what is the keynote message that you would like to give to our listeners or anyone who is involved?
Okay, before that, one achievement and initiative of the police department. Currently, we are also taking up the matter of these narcotic cases under P10 DPSI, which is a preventive detention. So it's been a recent experiences for us, but in almost all the cases, we are pursuing with the government to put on detention the traffickers or the financiers who are into this business. Now, from my side to end this program, like Madam reiterating, again I would like to say that treat this as a disease. Do not experience it, do not try it, and stay away from it.
What should be the way forward? Any message to our listeners?
Well, the only message that I actually have is to let everybody who's hearing or those who are tuning in, to let them know that they're not alone. That we understand the situation. We also empathize with what you're going through, and that you're not alone. And yes, we can do much better, and that's a failure on our part as well. Me personally, I take it as a failure that as a mental health care professional, I cannot invest like everything I have, and I need to do that as well. Yes, it's a failure on our part, but we are trying, and if you don't voice out what you're suffering from, or if you don't reach out to any of us, then how will we know and how can we help you? So please reach out to us and continue to fight.
That's a wonderful message. Thank you so much, everyone. And yes, there are facilities, there are agencies, there are authorities working for you. So if there's anyone that you know, or if you are one of them, though, I think it's the best thing is to start looking for help. And also on that note, I just want to remind to all our listeners that if you witness apnikan kumba drugs khayase, nulivik drugs la anything related to it, anonymously report as I always mention, you can use the app Call My Cop or Made in Nagaland. And with that, we come to the end of our program. Thank you so much. We had an interesting time today in our studio. We had Padma Shri Mrs.Neidonuo Angami, veteran social activist, Mr. Joybell, Deputy Superintendent of Police Crime, and Miss Suyimtenla, clinical psychologist, Tele-MANAS. Thank you so much.
Thank you.